Hello everybody, welcome to my YouTube channel, Homeopathic Super Sessions by Dr. Jarvis. Today I'll be doing the chapter of Carol Dunham, Alteration of Remedies, the first part on number 1. Well, in this chapter, in the American Homeopathic Review of 1863, an article was published by J.R. Cox regarding the approach of polypharmacy in prescribing. So in this chapter, basically, polypharmacy will be discussed. Also, the single remedy will be discussed. So out here, in an American Homeopathic Review journal, which is published by Cox, he advocated polypharmacy. Alternation of remedies are incompatible with the theory of true homeopathic prescription. So as you all know, in homeopathy, we use a single simple remedy in the unadulterated form, and we give it to the patient after taking into consideration the totality of symptoms. So Dr. Cox said that alteration of remedies can be done. However, Carol Dunham reminds us that it is totally incompatible with the true sense of homeopathic prescription. At times, it so happens we cannot find the correct synonym. So at times, we prescribe the remedies in alternation. Here, Dr. Carol Dunham also says that at times, it so happens that we may not get the characteristic symptoms, we may not be able to perceive the case in detail, we may not be able to get the exact symptomatology in order to prescribe. So at times, we can also use the theory of alternation of remedies. Now, the word alternation and succession of remedies need to be understood properly as they're not identical processes. So now let us see what do you mean by the word alternation and what do we mean by the word succession of remedies. So the first, alternation. Well, by alternation, 2 or more remedies are given to follow each other at short intervals. So 2 or more remedies are given at short intervals of time. Thus, when taken together, they cover the symptoms of the case more completely than a single remedy alone would do. So Dr. Cox, J.R. Cox said that alternation can be done, and in which 2 or more remedies are given at a short interval of time. And these 2 remedies, which were taken into consideration, they cover the maximum symptoms as compared to a single remedy when you would administer it. That means what? A single remedy doesn't cover up the maximum symptoms, but 2 remedies, they definitely cover up the maximum symptoms. The prescription is a result of one single examination of the patient and one single comparison of the symptoms with the material medical. So whatever you're prescribing, that's a prescription. You have examined the patient singly, and at one time you had seen 2 remedies which cover up the most of the symptoms of the case. A succession, the remedy is given either in acute or chronic disease. The understanding is that the first remedy, which was selected carefully, is allowed to exhaust action to its fullest extent. That means in succession, what are we doing? We are taking into consideration the case, we're taking into consideration the totality of symptoms, and we have carefully selected the drug. And we have administered to the patient, and we have allowed the drug to act at its maximum level, or allowed the drug to exhaust its action to the fullest extent. Then the case is again restudied, taking into consideration all symptoms, and a fresh prescription is made as if it was a new case. So that means when the first remedy given according to symptom similarity, according to the laws of similar, has completely exhausted its action, and there is no further improvement taking place in the case, then we have to restudy the case and again find out whether the previous remedy holds good or the symptoms have changed. If the symptoms have changed, then naturally a new prescription or a prescription has to be made as if it was a new case. So in this manner, the process is repeated in the same manner, and each new prescription is made until the case is cured. So in this process, in this manner, you go on giving different remedies according to the symptoms which change, and this is known as succession of remedies. So in succession of remedies, you're giving the remedy based on the totality as compared to alternation, wherein you are giving 2 or more remedies in quick succession, but it is not based on the totality. However, a very thoughtful article by Dr. Lane, in which he gives reference to Dr. Koch's articles, shows that nothing incompatible is there to these views. So another article by Dr. Lane, he gives a reference of Dr. Koch's article, and he says that, well, whatever Dr. Koch has said, it's nothing wrong, nor is it incompatible. He gives a case in which a remedy covered all the symptoms of the case and acted well only for some time, leaving the case uncured. So the case had been demonstrated in which the remedy had covered up maximum symptoms in the case, it had acted well for some time, but furthermore, no successive reaction of the medicine was taking place and the case was uncured. He then advises fresh study of the case with importance being given to the past history of the patient. So then he advises that you have to look into the past history of the patient. Thus, we find a suitable antisoric or antisyphilitic new remedy, which is strictly a homeopathic prescription. So therefore, he says that once we looked into the past history of the patient, we have to give either the antisoric or antisyphilitic medicine, depending upon whatever history we are obtaining, which is of a soric or syphilitic in nature, and give the antisoric or antisyphilitic medicine. In acute cases, not only studying the present symptoms, but also the previous history of the patient, a single antisoric remedy might be sufficient for the case. So therefore, in an acute case, we not only study the present or the presenting symptoms, but we also study the past history of the patient, and accordingly can give antisoric or antisyphilitic medicine as the case may from the past history of the patient. So in acute case, you go to the main history or the chief complaint plus the past history of the patient. In chronic disease, antisoric, antisyphilitic, or antipsychotic remedies may be required in the very beginning of the disease that appear to be most acute. So in a chronic disease, if you're getting an acute state in the initial stages, or there's an acute exacerbation of a chronic disease, then also you can give antisoric, antisyphilitic, or antipsychotic remedies if and when required. Furthermore, by repeated observations, he testifies by saying about the efficacy of sulfur in the case of most violent peritonitis. So now he's giving a case of violent peritonitis and where sulfur showed better result. Here the remedy sulfur was only required to bring the case to a speedy recovery. So sulfur was the main remedy in which speedy recovery of the case was there. He gives Hahnemann's reference of Organon, aphorism number 257. Of all known remedies, only one remedy will known to have preference. So he says that from all the known remedies in the homeopathic Metromedica, only one remedy will have its preference, or only you can choose one remedy based on the totality of the symptoms. Hence, the symptoms with the closest resemblance to the totality should characterize the malady. So naturally, we are choosing a remedy which has the maximum or the closest resemblance to the totality, and that remedy should be administered. Alternation does not deal with the new study of case, and it fails to come up with requirements of a true homeopathic physician. Whereas in alternation, naturally, we do not study the case, but we just give a remedy based on certain symptoms in which 2 or more drugs cover up the totality, and we give it in alternation. Example, in a case of pleurisy, bryonia covers up all the symptoms. The patient improves for some time and then ceases to improve. So in a case of pleurisy, according to the symptoms, bryonia is given, and what happens? There's some improvement, and again, the patient later on ceases to improve. Hence, the case studied again, and a new case, and some symptoms were ameliorated, but new symptoms appeared. So again, it has been the case has been studied as if it was a new case, and some symptoms were ameliorated, but new symptoms appeared. So the past history of the patient relieved a soric taint. The physician now takes all these aspects into consideration and comes to a conclusion of a remedy, sulfur, which has the maximum resemblance as compared to any other remedy. So After retaking the case again, the past history reveals a soric taint and Remedies sulfur was deciphered, or which comes up, which was better than Briannia because it covers up the past history of the patient, it covers up the soric taint. Therefore, an antisoric medicine would be useful. So, hence the prescription sulfur was given as it was a new case he was treated. So, sulfur was prescribed, and naturally, as if it was a new case he was treating. This is the instance of succession of remedies, and each prescription was homeopathic one in the strictest sense. So this is an instance or example of how you give succession of remedies, and each remedy is based on the correct totality. So that's all in this small video. So in this video, we have told you the difference between alternation and succession of remedies. Hope you enjoyed the video and hope you all have a clear understanding about the same. Please do stay tuned for more. Part 2 is coming. Thank you very much.